Welcome to Docs on Call, brought to you by Methodist Medical Center, with your host, Gina Morse.
Good evening and welcome to Docs on Call. Tonight's topic, heart disease. If you're like most people, you think that heart disease is a problem for other folks, but it's actually the #1 killer in the U.S. Heart disease is also a major cause of disability. There are many forms of it and many ways to treat it. Tonight is your chance to learn more about the ways to treat heart disease. Just dial 698-3742. That's 698-3742 to talk to our experts from Methodist Medical Center. Let's meet our guests. They are Dr. Adel, Mina, and Dr. James Locher of Methodist Medical Group Cardiovascular Services. Dr. Mina received his medical degree from Perpetual Health College of Medicine in the Philippines, also training in Egypt, and completed fellowships at Michael Reese Hospital in Chicago in cardiovascular disease and at Illinois Masonic Medical Center in Chicago in clinical cardiac electrophysiology. And Dr. Locher specializes in cardiothoracic surgery. He attended the University of Tennessee Memphis College of Medicine and completed his residency at Roanoke Memorial Hospital and University of Virginia Health Sciences Center. Dr. Mina and Dr. Locher will answer your questions about heart disease and treatment, including the new ablation therapy for atrial fibrillation and treatment to open blocked arteries. Gentlemen, welcome.
Thank you.
Now, Dr. Mina, I know you like to think of yourself as the heart rhythm specialist. You're really concerned with kind of that the way our heart beats and getting it on the right rhythm. Talk to me a little bit about that.
Well, the heart rhythm is the main thing that is the structure where all of the contraction of the heart starts with a rhythm first. And there's a lot of people who has rhythm problems, and these rhythm problems can cause a lot of symptoms. And that's why this is my specialty, is try to treat this rhythm, whether with medications or ablative therapy.
And yet sometimes those rhythm issues go undetected. We've heard about that in the news, unfortunately, lately with even some local athletes. Why is that?
Well, it's some of the rhythm, if they don't provoke the heart rate that is quite fast, they might be undetected. But fortunately, most of the rhythm, they could be detected with symptoms. But sometimes also the rhythm starts all of a sudden and could be life-threatening as well. So, and some of people can die suddenly from rhythm problem, unfortunately, without having preceding symptoms too.
And so in that case, there's not too much you can do, but you can take good care of yourself and reduce those risk factors for heart disease, right, Dr. Locher? I know that you are perhaps not seeing as many people in surgery as you used to because of advances in technology, and you say that's a good thing.
Yeah, it's a good thing. It used to be that coronary bypass surgery was amazingly prevalent, still is prevalent. But I think over the last 10 or 15 years, the cardiologists, my partners, the cardiologists, have gotten very good with balloon angioplasty and stent. We call it percutaneous coronary intervention. They've gotten to be just great with, they can stent just about everything. Not that they should stent everything. And we know certain patients do better with open heart surgery. We know patients do better with percutaneous coronary intervention. But the cardiologists have gotten good enough that they can offer that to a vast array of patients. And so it keeps a lot of people out of surgery. And so the surgery is left for the patients that really, really absolutely have no other options. And that's what I do. And what we've seen over the last few years is that as our population ages, is that we're seeing a greater proportion of valvular problems, patients that have valve problems. So just about, it seems, it's not always, but it seems like a great percentage of our patients anymore have an associated valvular problem that we have to fix.
Older we get, the better our chances of those valves wearing out.
That's exactly right.
All right, we've got our first caller. Michael, you are on the air with Docs on Call. What's your question?
Well, my question is, my father died very young from his first heart attack, and heart disease runs in the males in our family. My grandfather died at the age of 42, I do believe, of his first one. And I'm 28, and I already am on a cholesterol pill. and I was wondering how prone am I to have any symptoms of heart disease?
What would you say to him?
Well, definitely there's familiar history is important. Having a family history of sudden cardiac death or heart attack makes you more vulnerable than other people who doesn't have that family history. If you do have any symptoms of cardiac problems, it's better that you have yourself checked, and sometimes doing like a stress test or anything with early symptoms, even doing just EKG might be helpful to know your risk in terms of have a future heart attack.
And Dr. Locher, what would you tell Michael about lowering his risk given his family history?
I think it's amazingly important. I see patients every day that have the same family risk factors, and they're smokers and they eat bad, and that's how they come to me. And what I tell these patients is that given their family risk factors, they know they're more prone to coronary disease. And so if they want to live, if they truly want to live a good, normal life, they have to take good care of themselves. And that means they shouldn't smoke. They should eat the right things. They should eat the heart-healthy diets that everybody talks about. They should get exercise. They should try to moderate the stress. So they've got to do that. And I'm very passionate about that, because if they don't do that, they're already predisposed to having problems.
Let's hear what our next caller has to say. Judy, thanks for watching Docs on Call. What's your question?
Yes, sir. I live out of state. My father's 88 years old, and he has what he calls spells. I finally got him to go to a cardiologist, and they said that the upper part of his heart beats too fast compared to the lower part, and the lower part cannot disperse of the blood, and basically he has to live with this. Can you give me any more information about this?
Okay, she wants to be the informed daughter as a potential caregiver.
Sure. It means like your father probably has what we call atrial fibrillation. So atrial fibrillation is an abnormality coming from the upper chamber of the heart, causing the upper chamber to beat as faster even than 300 beats per minute, causing the lower chamber to beat very fast, also maybe 100 to 150 beats per minute, sometimes even faster. And this is common at elderly people, and it does have a treatment in treating this. We usually start with medical management with antiarrhythmic medication and with medicine that lowers down the rate. And once this failed, we go into more curative therapy, doing ablation and more invasive but curative approach.
Real quickly, can either one of you talk about that ablation therapy, because that's something that you're doing more of now?
Sure. Atrial fibrillation ablation, we now know that atrial fibrillation is related to abnormal impulses coming from the left upper chamber of the heart, and we are able to isolate these impulses by doing a scar around it and preventing these impulses to go to the rest of the heart, what we call pulmonary vein isolation. This is done with minimal invasive approach using catheters that goes through the groin and goes to the heart, and we're able to map where these abnormal impulses are created, and we do like a roadblock to prevent these impulses from happening. And usually success rate for the procedure is quite high, close to 85% most people, and the patient goes home the second day. So it's a very new and novel way of treating, definitive treatment for atrial fibrillation, and it's very effective as well.
Going home the next day, pretty amazing. Let's hear what Harold has to say. Thanks for watching Docs on Call. What's your question?
I was wondering what you could tell me about pulmonary hypertension, known as PHA, the treatment of it, and the success rate.
Gentlemen?
That's one for you.
Okay.
Take it.
All right. Well, pulmonary arterial hypertension could be related to many causes, sometimes related to lung clots that has been there for a long time. We call it chronic PE. Sometimes related to severe lung disease, sometimes related to abnormal autoimmune disease. So we usually, when you have pulmonary arterial hypertension, we work up the possible causes, and there is also new treatment for it in terms of more medications that are approved for it, and it's quite effective when all other causes has been excluded.
It's time for us to take another call. Chris, you're watching Docs on Call. What's your question? Oh, I think we may have lost Chris. Chris, are you there? No, I think we're going to move on for now. How about, Lamont had this question about blocked artery in left arm but can't operate. Clearly worrying about something more going on. And before we get to that thought, we've got Chris on the line, so let's make sure to get right to him. Chris, what's your question?
Yeah, I saw my physician today in regards to some hypertension, and they did lab results, so my triglycerides are high. A couple other things. They've had me on clonopro, HCZ for a little while. And she today put me on another blood pressure med, and told me she wanted me to take a baby aspirin. I'm 32 years old. There is some weight issues there, and my family does have some slight background of heart disease. I was wondering if that sounds right to you. I mean, I work in the medical field, and the baby aspirin thing. I don't usually run into a person in the field until some older patients. I haven't quite seen it at my age, and it's probably making myself look bad, but I just.
So you're wondering some about the importance of the aspirin and the blood pressure medications at a young age.
Yeah, I mean, I understand that it needs to be, controlled, and I just so much at once at my age. That kind of concerns me a little bit.
Sounds a little overwhelmed.
When you're having high blood pressure at a young age, we try to see what's the reason, because usually high blood pressure affects older people. And when you have at a younger age, there's some hormones that can affect, cause your blood pressure to be high. That's worth actually checking. And also, it's very important to continue with the treatment. The other thing is sometimes overweight is a major factor for high blood pressure at a younger age, and weight loss will be very helpful in that regard.
Dr. Locher, it goes kind of back to what you were saying is, you know your risk factors, you got to do something about it if possible.
Yeah, what I see is a lot of patients that if they would alter those risk factors, if they're overweight, if they lose weight, say for instance they're diabetic, and if they would lose weight and eat right, then a lot of times their diabetes goes away, their hypertension goes away, and they can be medicine-free. So this caller, certainly I'm sure there's medical reasons why he needs to be on medicines, and he probably needs to start there. But if he would alter his lifestyle over time, he may be able to be medicine-free. And I think that's amazingly important for him because he's so young.
Okay. Time for us to head to a break. When we come back, we're taking more of your calls about heart disease, and our experts from Methodist Medical Group Cardiovascular Services will answer your questions. You're watching Docs on Call. We'll be right back. Welcome back. Heart disease is the leading cause of death in the U.S. The most common type is coronary artery disease, which can lead to heart attack, and our experts from Methodist Medical Group Cardiovascular Services are answering your questions tonight about heart disease. Just dial 698-3742. Dr. Mina and Dr. Locher, we thank you again for being with us. We want to get right back to our calls. And Barbara, thanks for watching Docs on Call. What's your question?
There were 12 children in my family, and 9 died of Marfan syndrome. I was told in 1980 that my children, since I don't have it obviously, or my grandchildren would never be affected with Marfan. Does that still hold true?
Is that accurate to you, the best of your knowledge?
Well, Marfan definitely is a hereditary syndrome, and it does have clinical characteristics of running into a certain pedigree in the family. So I don't have her family pedigree to say for sure, but they can be able to tell you who's likely to be affected based on genetic testing.
All right. And I believe our next caller has a question in particular that Dr. Locher might be able to answer. Let's see. We've got Dave on the phone right now. What is your question?
I've had atrial fibrillation for many years, probably 10 or more, and when I was diagnosed with it, a couple of years afterwards, they did shock therapy on me to try and get my heart rhythm back to normal, and they did that 3 times and it didn't work. I was wondering since then, which would have been probably around 2000, has anything come along that could possibly work to get my heart back in rhythm?
Definitely, has been a lot of advancement in atrial fibrillation. What you have is what we call long-lasting persistent atrial fibrillation. Means it has been going on for a very long time, and it's when it comes to a stage where it is resistant to shocks, sometimes it's very hard to treat, but we would like to consider at least starting antiarrhythmic before giving shocks, because when you start antiarrhythmic, there's a higher possibility that the shock might work the next time. And also considering down the line ablation therapy, which also may be curative in that case.
All right. Let's hear what Wayne has to say. Thanks for watching Docs on Call. What's your question?
Yes, doctor. I'm 69 years old. In 97, I had a heart attack and then a quadruple bypass. And since then, off and on, I've been in atrial fibrillation. Right now, I see my cardiologist tomorrow, and I have been in atrial fibrillation for 5 days now, and the most it's ever been before was 3 days. He had mentioned this procedure to you before, or to me before, and I'm wondering if this procedure is possible of going through the groin and trying to get this stopped.
Yes, definitely it's possible, and we like to consider candidates for procedures who has failed one rhythm medication at least, and they are symptomatic, means the atrial fibrillation is causing them to have some kind of symptoms. And it looks like from the way you describe it, it comes back and forth. This is what we call paroxysmal, and usually the success rate for paroxysmal atrial fibrillation with the procedure is quite high, approaching about 85 to 90% success rate for the procedure.
And Dr. Locher, is there a point where you as a cardiothoracic surgeon have to step in when someone, say like Wayne, has done everything he can do up until this point, and if he even does this procedure and it doesn't give him the success that he's hoping for?
Yeah, Dr. Mina and I can do sort of the same procedure. My procedure is more invasive. Typically, I can do an atrial fibrillation ablation also. I usually reserve my ablations at the time of concomitant heart surgery. So if the patient is in surgery for bypass surgery, or they're in surgery for valve surgery, and they have atrial fibrillation really for any reason, for me, it's a fairly easy procedure where I can do an ablation because I'm right there on the inside of the heart, and I can ablate the same pathways that Dr. Mina does while I'm in surgery, and also have a very high frequency of being curative for atrial fibrillation. So again, I'm sort of reserved for the end-stage cases.
When you're already having to do major surgery beyond that. All right. Jack is our next caller. Thanks for watching Docs on Call. What's your question?
It's not really a question, just their opinion. I was an atrial fibrillation patient most of my life. I was cured 12 years ago by the Maze procedure, and just want to get their opinion of it.
Okay, comparing to another procedure, the Maze procedure, what do you know?
Percentage of cure rate compared to like.
Did you have an open Maze procedure, a surgical, where they made an incision in your chest?
Yes, I did. I had the open chest.
Yeah, that's the grandfather of all these procedures. Is the Maze procedure was created by a single surgeon, and the outshoot of that over the last few years has been the less invasive ablation procedures. So the gold standard still has been what you had. And what you had was a big operation, but they had tremendous, great success with atrial fibrillation being cured. And so really, for somebody that had a true maze operation, the chances of success long term was probably greater than 90 or 95%. So you had the gold standard. So I think you can hang your hat on that you had the best there is.
Let's go now to Sharon and see what she has to say tonight. Thanks for watching Docs on Call. What's your question?
I have had a heart attack in 2006. And I, before that and since then, if I have like one alcoholic drink a year, my heart just starts racing. Or if somebody tells me something like bad news, it just feels like my heart's pounding on my chest. But I was wondering why even one drink of alcohol a year would cause that.
Why would that be?
Some arrhythmias that are provoked by alcohol. One of them is the atrial fibrillation. So it's possible that you do have arrhythmia and the alcohol provoked the rhythm to start. And usually in most cases, though, a higher amount of alcohol that's triggering the atrial fibrillation. But the other thing is we have to really see if you really have a rhythm problem or you're just feeling palpitation, because sometimes you could be aware of your heartbeat, but that necessarily doesn't mean that you have a rhythm problem. And a documentation of what's happening exactly after your drink is with EKG or a strip or anything like that will be helpful.
Is that a common side effect after heart surgery, to have that feeling or to have a trigger that makes you feel as though your heart is beating much faster?
Yeah. Atrial fibrillation is very common after heart surgery. The good news is it's usually self-limited. It usually goes away after a few days or a few weeks. But it is very common after heart surgery for patients, especially for the first few months, to tell me that they really can sense their heart pounding. Sometimes they say it feels like their heart's beating out of their chest. But again, that's usually self-limited. Over the long term, that goes away.
Okay. Kate is on the line next. What's your question for our experts tonight?
Hello, good evening.
Good evening.
I'm a very concerned sister. I have a sister that was diagnosed with thoracic outlet syndrome and RSD, and very much pain, very severe. And she has these shocks that go up her arm to her heart. Can you tell me, is there any relief that can help her?
Yeah, actually, thoracic outlet syndrome can be quite disabling. And there is an operation that can relieve that. Typically, there needs to be a lot of testing, sometimes in combination with a neurologist, to see exactly what structure. There's a number of structures up in the thoracic outlet that can be compressed, and you can tailor the operation based upon that. But there is an operation that can help a patient with thoracic outlet syndrome tremendously and can give them their life back.
Randy had this question for us, saying, for the past month, my heart's been pounding even when laying down. Is this something I should be concerned about?
Well, definitely having a heart palpitation is not normal, and I think you should be checked. There are variable modality of checking it. One is just doing a Holter monitor, one doing EKG. Depending how frequent is your symptom is, and if your symptoms are quite sporadic, there is something called 30 days event monitor. Will be able to check exactly what rhythm you have and treat it accordingly.
Okay. Jim's on the line now. Jim, thanks for watching Docs on Call. What's your question? Jim?
Yes.
Go ahead. What's your question?
Okay. I'm 74. I'm normal weight, no high blood pressure.
Okay.
And I drink 3 or 4 beers at night. It takes me about 3 hours to drink them. And I was wondering if that was hurting or helping my heart.
What do you think? He doesn't have, it doesn't sound like he's having any other problems, but he admits he's got 3 or 4 beers a night.
Right.
Dr. Mina could probably answer this better than I can as a heart surgeon. I know that there is some data that with, especially with red wine, that can be cardioprotective. I don't think really anybody recommends that you ought to drink significant quantities of alcohol to try to develop that cardioprotective effect. As far as the cardioprotective effect from beer, I'm not aware of that. Dr. Mina, I'll throw that question to you.
Could it be detrimental?
Yes.
Those 3 to 4 beers every night?
I would, if it's you're talking about 2 or 3 beers every night, there's a cumulative effect of that over time, and your heart can potentially get weak. I usually pass, like, if you're doing like 1 drink a day, whether it's wine or beer or anything, but the more you go, the more likely you will hurt your heart. So with the beer, it doesn't have as good protective as, of course, wine, especially red wine, because of the flavoproteins in the wine. But if you want my advice, try to cut it down.
Okay. Well, our time is quickly running out, gentlemen. Doctors, we appreciate you taking the time. I'm going through this stack here because these are all the questions from people like Francie, who had a question about diagnosis of IDC always lead to a heart transplant. Does it have to? Quickly, do you think, does that diagnosis always lead to a heart transplant? IDC?
I'm not aware of what she's talking about.
Okay.
Anyway.
We'll talk about it off air and try to get to Francie's question, and we thank you for joining us for Docs on Call. Join us again next time. Until then, I'm Gina Morse. Good night.